Hello everyone, I am Dr. Krithishree. I have done my Masters in Psychiatry with a degree of MD Psychiatry and I am working as Consultant Psychiatrist in KMC Hospital, Mangalore. Panic attack is sudden surge of intense fear and discomfort which leads to emotional distress and physical discomfort. The symptoms in panic attack builds in a brief period of time within few minutes. It has two sets of symptoms, physical discomfort and psychological distress. In physical discomfort, symptoms like chest discomfort, palpitations, sweating, feeling of numbness around the feet and tingling sensation in the face, dizziness, abdominal discomfort, feeling like throwing out. These are some of the physical discomfort symptoms. Coming to psychological distress symptoms, here they have a mix of emotions like suddenly crying, feeling extreme anxiousness, too much negative thoughts are seen in them. If you happen to have a panic attack in mid-air, the first thing first is to set your breathing because the core symptom in panic attack is hyperventilation. So some of the strategies is box breathing. Here the person is asked to slowly inhale, hold the breath for few seconds and exhale slowly. Usually the count of 4 seconds of inhalation, holding the breath for 7 seconds and exhaling over a period of 8 seconds is practiced. During this process, the whole attention is shifts into the exhaled air and the movement of the belly. Next is grounding your senses. So some of the grounding techniques like 5, 4, 3, 2, 1, where a person shifts his whole attention by activating his senses. That is 5 things what he sees, 4 things what he can hear, 3 things what he can feel, 2 things what he can smell and a thing what he can taste. Here it helps the patient in grounding to the present reality. So some of the other ways of doing is holding grounding objects like taking help of cold water bottle or holding a book. During this process, helping the person to shift the attention in explaining the texture and the feeling and temperature of the objects what they are holding. Gently relaxing and moving around can also be helpful. Next is reorientation of their thoughts and rationalizing them. Reminding them it's a panic attack. They would have already experienced such panic attacks previously in their life. So telling them it's not a lethal attack, it's not going to harm them, will help them to calm them immediately. Some of the distracting techniques like reading something whatever is available, counting the number of seats or even simple mental math can help them. Next is listening to calming audio. And if the patient is having medications, taking medications can immediately relieve the panic attacks. Some of the symptoms what we see in panic attacks mimic mostly deadly diseases. That is chest discomfort and tightness mimics heart attack. Feeling like dizziness, falling like fainting or blacking out, this usually mimics illnesses like heart attack or reduced low BP or even arrhythmias. Numbness of hands, feeling of tingling sensation around the face and feet, this mimics stroke and transient ischemic attack. Symptoms like stomach ache, abdominal discomfort, feeling like throwing out, nausea, these symptoms mimic GI complications like food poisoning and all. Feeling of impending doom and intense fear like feeling fear of dying can mimic mental breakdown. Panic attack as such produces a panicky situation because most of all the physical symptoms which are associated with panic attack mimic medical emergency conditions. For example, chest discomfort, palpitation. These are the symptoms which actually mimic gastrointestinal emergencies like food poisoning. Symptoms like dizziness, feeling like fainting or like feeling like blackouts. These are the symptoms which are usually seen in conditions like stroke, transient ischemic attack. Then coming to symptoms like numbness of the feet, tingling sensation in the face and feet, these are usually seen in conditions like transient ischemic attack, stroke, low BP. Then symptoms like sweating, tremulousness or shaking, these are the symptoms seen in hypoglycemia or thyroid crisis and even in low blood sugar levels. And last but not the least, symptoms like impending doom or overloaded thought process. This mimic mental breakdown. Hence, these symptoms actually warrant medical emergencies and create a panicky situation in patients. Fight-flight response is an automatic survival mechanism which helps the person rapidly prepare them to escape or comfort from the perceived threat. Here what happens, it's actually an evolutionary adaptation which has evolved over the years in human beings to protect themselves from perceived threat like predators. So usually what happens during this fight-flight and response, the autonomic system gets activated and it releases large amount of adrenaline. It's also called as an adrenaline rush kind of situation. So as a result of which the blood from the vital organs gets shifted into the organs which helps the body to increase the strength, speed and alertness. This is what fight and flight reaction is all about. Some of the breathing and grounding techniques can help an individual relieve panic attacks. Breathing techniques are very important because the core symptom seen in panic attack is hyperventilation. So fixing the breathing becomes the first important factor. Here techniques like box breathing, where slowly inhaling, holding the breath for few seconds and exhaling helps the individual to relieve them and slow down the breathing. Where the person would be having fast breathing, it helps them to slow down the breathing. Usually technique of 4, 7 and 8, that is slowly inhaling for about 4 seconds, inhaling over a period of 4 seconds and holding the breath for 7 seconds and slowly exhaling over 8 seconds is helpful. Grounding techniques like strengthening your senses through technique like 5, 4, 3, 2, 1, that is 5 things what they can see, 4 things what they can hear, 3 things what they can touch and feel, things what they can smell and 1 what they can taste is helpful. Other grounding items like holding a cold like piece of ice in your hand or like any items and identifying like getting into the depth of their texture, temperature will help shift their focus from the intrusive thoughts to the present situation. Most of the symptoms which are associated with panic attacks mimic medical emergencies like heart attack, bronchial asthma, pulmonary embolism, transient ischemic attack, stroke, thyroid crisis, GI emergencies, that is gastrointestinal emergencies like food poisoning, even mental breakdown. When it is a first panic attack, it should never be ignored. Especially in individuals more than 40 years, a first panic attack should not be ignored and it should be like immediately brought into the scrutiny of examination and detailed evaluation. Then if at all a panic attack is persisting for more than 1 week and despite the medications, then also medical evaluation is must. Even though the patient is a known case of anxiety disorder who's been having frequent panic attacks if any attack lasting for more than 30 seconds, it should not be ignored. Finally, if a panic attack is so severe that it is causing socio-occupational dysfunction, disruption of their relationship and affecting their work, then it has to be brought into the medical scrutiny and evaluation.